Okay, I'm just gonna wash my hands. Good morning, my name is Carolyn. I'm gonna be your nurse practitioner today. I'm going to be assessing your abdomen and nervous system today. Do you have any questions or concerns before I begin? No, okay. So first I'm just gonna inspect the skin and contour of the abdomen. There's no scars, stretch marks, rashes, or lesions present on the abdomen. As you can see, there's no umbilical hernia present. Contour is normal. The abdomen is slightly rounded and symmetric. And then the patient, do you have any pain in your abdomen at all? No pain? Good. So when I look, I can see peristalsis and pulsation slightly because the patient is on the skinnier side. And now I'm going to listen to the bowel sounds and listen over the aorta, iliac, and femoral arteries. So when I listen, I will be listening in all 4 quadrants. I am hearing bowel sounds regularly. They are not hyperactive or hypoactive. I don't hear any bruits over the aorta, iliac, and femoral arteries, and I have not heard a friction rub in the patient. Next, I'm going to percuss all 4 quadrants of the abdomen. So I'm going to go like this. So in reality, it would be like this. I hear dull sounds over the liver and the spleen. Next, I'm going to do light palpation to deep palpation over all 4 quadrants. So, so it'll be like this, and then deeper. And then I'll have the patient, when they're supine, bending forward to feel the fold. And this would be normal and not showing ascites if I can squeeze the fold of the skin. I don't feel any masses present or any superficial organs when I palpate the patient's abdomen. The patient is not guarding. There's no rebound tenderness present in the para-umbilical area. And there's no rebound tenderness in both lower quadrants. So I will test Murphy's sign, which I'm going to ask the patient to exhale and then take a deep breath. And I'm going to press down on the right lower quadrant. And this is going to be medial to the midclavicular line. And when I do this, there's no pain noted. So that's a good sign that the gallbladder is not inflamed. Then Ravsing sign, I'm going to do that. I'm going to press down on the left lower quadrant. There's no rebound tenderness present, so this is not showing any acute appendicitis. I'm not able to palpate a normal healthy spleen in this patient. This would be the same with the other sign, process. I don't know how to say that. Sorry, this is the same in, so this one I'll have the patient lying down and I'll have them, I'm going to demonstrate it, I'll have them flex the thigh against my hand. And there's no tenderness or pain present there, which is another good sign showing the appendix is healthy. And then the obturator sign is the last one, and it's the same thing. I'll have the patient lying down, and then I'm going to have them flex the leg up and internally rotate the hip. So bring the knee in towards the body. As long as there's no pain there, that's another good sign. Next, I'm going to percuss the liver at the midclavicular line and mid-sternal line. You start low, and then when it gets dull, the liver has been reached. And then I'm gonna do deep palpation under the right rib cage of the right lower quadrant. You should start low to see if you feel the edge of the liver, because it can be low in disease. And you want to ask the patient to take nice deep breaths, and then you can find the edge of the liver. In my patient, the liver is normal size, there's no enlargement noted, and no pain felt on palpation. Next, you're going to percuss the spleen on the left side. Same thing. You're going to not hear anything because the spleen is not going to be an abnormal size, and I'm not going to be able to palpate it because the spleen is healthy in this patient. Next, we'll use the kidneys. So on the back of the patient, you're going to percuss lightly. There should be no pain felt. There's no pain on this patient. He is content. And then I'm going to ask the patient to take a nice deep breath, and I will, under the 12th rib, try to lift up to displace the kidney anteriorly. And they can take a nice deep breath, and you can try to capture the kidney in your hands. I'll palpate the CVA angle on each side to see if there's any tenderness. No tenderness is present on any of the kidneys or the CVA, and the bladder and the suprapubic area is non-tender. Lastly, I can palpate the aorta width, and there's no pain on palpation. Okay, next I'm going to ask the patient. First I'm going to assess the patient's appearance. He is looking healthy and clean. He just got a bath. He is alert and listening to my commands and has a normal mood. Let me put this over here. All right, Brady. So next I'm going to say, what is your birthday? And he's going to answer correctly. And then I'm going to ask, where is he right now? And he's going to say, at the primary care office that Carolyn works at. And then I'm going to say, what is today's date? And he's going to answer correctly, August 17th, 2021. And what brings him in today? And he is here for a checkup. And he is alert and oriented ×4. The patient's eyes are open and they respond fully to stimuli. And then we're going to test the cranial nerves. So I'm going to have an alcohol pad, and I'm going to occlude each nostril and have the patient sniff to the other side, and he can definitely smell. And then I'm going to test his visual acuity. First, I'll have him look at a Snellen chart across, and I'll have him cover one eye at a time and read as many rows as he can down. Good. The patient doesn't wear glasses, he states, and he is able to read the Snellen chart down to the 5th line on both sides at the same distance. All right, and then I'm going to inspect his size and shape of his pupils. Very good. Pupil size is equal and reactive bilaterally, and they are 2 millimeters on each side. They're in alignment, and when I shine a light, so I'm going to cover one eye, shine a light, cover the other eye, shine a light. The pupils react and constrict in direct light on both sides. All right, and then I'm going to have him look at the 6 cardinal directions when holding his head still. Pretend his head is still. Good boy, good boy, good boy, good boy, good boy, good boy. So those are intact, extraocular movement's intact. There's no restriction of eye movement and no nystagmus noted. His lid crease is normal. His upper eyelid crease is normal at 6 millimeters. And convergence, so I'm going to have him look at my finger as I come in. Convergence is normal. And then I'm going to palpate the temporal and masseter muscles when the patient clenches his teeth. Good. And then I'm going to check sensations. So, all right, this is going to be the soft. Do you feel that? Yes. 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 Then, do you feel this? That's going to be sharp. So dull and sharp sensations, symmetric on both sides. And I'm going to have him open his mouth and hold it against, and do not let me close it. Like that. Good boy. And then the corneal reflex, I'm going to depress the lower eye. And then I'm going to have him look upward, and I'm going to touch the cotton ball tip to the edge to check for the blinking reflex. And when we look at his face, the face is symmetric. There's no tics, abnormal movements present, and all movements are intact. And then the patient denies any change in his taste. Next, I'm going to do a hearing test. His hearing is equal bilaterally, and we'll do some work with the tuning fork. So I will hit the tuning fork and hold it behind the bone on the ear, right here. And he's gonna tell me when he hears it and when the hearing stops. And I'm gonna do this on both sides. And then I'm gonna hit the tuning fork again, and I'm gonna hold it in the middle of his forehead. Good boy. And he's gonna say he hears it loudest in the middle, which is normal. And then lastly, I'm gonna cover one ear and whisper a number, 77. He's gonna tell me 77, and I'm gonna practice on the other side, 77. And he hears, and it's equal on both sides. His voice is not hoarse. I'm gonna have him swallow a sip of water, and his swallowing is intact. And I'm gonna have him say, ah, good job, Brady. And it looks normal, his uvula and tongue, and the gag reflex is intact. And then I'm gonna have him shrug his shoulders upwards against my hands and not let me push down. So shoulder strength is normal. And then I'm gonna have him push his head against my hands on both sides to assess neck and shoulder strength as well, which appears normal. No. Oh, this is a good position for the belly exam. All right, I'm going to ask the patient to protrude his tongue and move it side to side and assess for symmetry and atrophy. So you'll ask the patient to stick his tongue out, move side to side, and even have him push against his cheeks against my finger with his tongue. His tongue is symmetric, there's no atrophy present. Brady. And then we're gonna look at his motor system. He's in a normal body position. His coordination is normal. Gait and stance appear normal when he's standing. There's no tremors, tics present. Good boy. Okay. Next, we are going to look at the muscle bulk. Brady. Good. Look at these arms and look at these legs. Good. And most muscle bulk and tone are normal. There's no atrophy noted in the proximal or distal muscles. Next, we would assess muscle tone in all areas. So first we can do the pronator test. So your palms are gonna be up, and he's gonna close his eyes for 20 seconds, and there should be no movement. Next, the practitioner can push down and make sure he can keep his arms up. They can do this also here, and see if he can do here, and push up and down against resistance. The biceps as well, they're gonna do flexion and extension and push against and push upward. Hand grip, I'm gonna use my 2 fingers, and he's gonna squeeze my fingers on each side. Trunk flexion, we'll see if he can bend laterally and then push up against my hand with his thigh and push down. Same thing for hip, abduction and flexion. And then put this down. So for this, push out, push in. Same thing with ankle, press down like you're on the gas pedal and push up, all against resistance. His muscle strength and tone, I would give him a grade 5. He has active movement against full resistance without any evidence of fatigue. So this demonstrates normal muscle strength. Then I'm gonna have patient is going to tap his tip of his index finger rapidly against his thumb. And then I will have him point to different areas of my, as I go. And he can go back against his nose too and press to do the point-to-point movements. And then I will have the patient walk across the room. I'll do that like this to demonstrate what he would do because he's sleeping. So just a normal walk across the room, and then a heel to toe walk. There's no swaying. His gait is normal. He is able to do all those exercises, and he denies any dizziness or vertigo. And then lastly, we will do the Romberg test, which is he's going to stand with his feet together, eyes open, and then with eyes closed for 30 to 60 seconds. And there should be no movement. He shouldn't fall backwards or fall forwards or fall side to side. A little bit of swaying can be normal. Okay, Romberg test and the pronator drift were negative in this patient. And then again, we will assess pain and light touch against each side of the body. So for pain, or for light touch, we'll use a cotton ball. We'll do each side symmetrically, and he feels on each side the cotton, and then we'll do pain with a pen, and he will feel each prick. And then lastly, we will use a hammer. I guess I can use this. And I'll put you back up here to show you, to see deep tendon reflexes. So he will be hanging his feet off the bed, good boy, and he will dangle and hit, and your leg should come up. Dangle and hit, and his leg will come up. Okay, that's it. Thank you for watching. Sorry I have to do this on my dog. I'm travel nursing and there's no one here today. All right, say bye-bye.